In our Health Watch this evening, WCCO has learned that hospital leaders will be meeting again this week to make a game plan for the surge in patients visiting emergency rooms across the metro.
As Jonah Kaplan reports, the issue now goes beyond the number of patients. It is making sure that doctors and nurses themselves don't get sick.
Everyone gets sick.
But what happens when those who provide care are the ones who need it? At Children's Minnesota, the metrics matter again. Too many cases of the flu, RSV, COVID, and norovirus, the so-called quademic. It means doctors and nurses will be wearing masks again when seeing patients. That includes pediatrician Dr. Chase Shutak.
You know, it's the same rule as on an airplane. If you don't put on your oxygen mask first, you can't put on anyone else's oxygen mask. So if I'm sick, if one of my colleagues is sick, then we should stay home.
The sickness surge is clogging emergency rooms everywhere. At Children's, M Health Fairview, Alina, and Hennepin Healthcare. According to Dr. Shutak, parents understandably are nervous about their children's well-being, but the ER should be the last resort.
Even when a child is vomiting a lot, they may not truly be dehydrated. And so you may feel the need to kind of go into the emergency department because, oh my gosh, my child won't stop throwing up. But they won't necessarily do anything there that they wouldn't do at the clinic.
When to go to the ER is a tough call, but the route of emergency is emergent. One question for parents to consider: is the issue worth what could be a very long wait?
The couple of things that really require you to go to the emergency department tend to be either trauma, so some sort of accident or injury, or a really significant breathing problem. So you're starting to turn blue, you're working harder to breathe.
In Minneapolis, Jonah Kaplan, WCCO News.
Dr. Shutak says we still haven't reached peak flu season, but we may have plateaued with RSV. He says it's critical that everyone washes their hands frequently, and he says that we shouldn't share food or drinks, especially children.